Good afternoon, everyone, and welcome to Medical Benefits Scheme Prevention Unit Cervical Cancer Health Awareness Webinar. I am Justina France, Supervisor within the Prevention Unit, and the topic for today is the status of cervical cancer in Antigua and Barbuda. I will be introducing our host, Mrs. Isabel Charles Jenkins, who will in turn introduce our presenters. Mrs. Isabel Charles Jenkins graduated from the University of Santa Clara, Cuba, as the most integral student and went on to pursue her MBA with merit at the University of Leicester in the UK. She has completed a number of diploma and certificate courses, which include drug supply management with the University of Limpopo, South Africa, project management facilitated by the UWI Open Campus, Antigua, graduated as top student, financial management with Cornell University, New York, and blended learning designed with Commonwealth of Learning. Evel has worked extensively in the field of health and pharmacy between the islands of Cuba, St. Lucia, and Antigua. Her work has included studying the therapeutic benefit of the Morinda citrifolia, also known as the Nuni plant, as well as evaluating strategies for marketing behavioral change in healthcare. Evel is currently employed as a senior pharmacist with the Antigua Barbuda Central Medical Procurement Unit Medical Benefits Scheme. She is also a part-time facilitator with the Antigua State College School of Pharmacy program, focusing on dispensing and pharmaceutical compounding. She has always had an interest in wellness. To this end, she has been a presenter with the Medical Benefits Scheme Take Charge of Your Diabetes program and is a contributor to her community newsletter. Evel is a member of Antigua First think tank Antigua and Barbuda Council on Sustainable Development and was a member of the original planning team which successfully hosted Antigua's very first TEDx Antigua. Please join me in welcoming Mrs. Evel Charles Jenkins.
Good afternoon, everyone. I'd like to say thank you. Thank you to Ms. France for inviting me to be a part of this discussion this afternoon. We're going to discuss the status of cervical cancer in Antigua and Barbuda. And I'd like to, first of all, extend a warm welcome to all of our participants who are tuned in with us this afternoon, this evening. I know it's been a pretty long day, and it's very heartwarming to know that despite having had a long day, you've still taken the time to join us this afternoon for this discussion on the status of cervical cancer in Antigua and Barbuda. Cervical cancer has been ranked among the top 10 cancers worldwide. And I'm sure that some of us have been, or most of us have been impacted by the effect of cervical cancer within our community, within our society. It could be a family member, it could be a friend or a friend of a friend. And it is extremely important today that we welcome our panelists who are here to share a wealth of knowledge with us on the status of cervical cancer and what it is that we can do moving forward with that information. As we proceed, we will have three panelists this afternoon, Mr. Beauville, Mrs. Gardiner, and Dr. Tulloch. Each participant will present for their allotted time, and we will be taking the questions per participant after the participant has presented. I'm sure you have a number of questions to ask, and I can't wait for us to begin this discussion. With that, we move on to our first presenter Our first presenter is Mr. Andre Beauville. Andre Beauville is a registered pharmacist and epidemiologist, and currently the Director of Pharmacy, Prevention and Nutrition at the Medical Benefits Scheme. He received his formal training in pharmacy and management at the University of Guyana and subsequent training in epidemiology at the London School of Hygiene and Tropical Medicine at the University of London in the United Kingdom. At the Medical Benefits Scheme, Mr. Beauville leads a highly technical team of pharmacists and technicians, along with teams in prevention units and the nutrition department. He currently sits as chairman of the MBS Formulary Committee and was a former member of the OECS Tender Awards Committee for some 2 years. Besides an interest in healthcare, Andre Beauville, who is also Audit Committee certified, has served as both member and chairperson of the Supervisor and Compliance Unit of the St. John's Credit Union. He is also a member of the Antigua and Barbuda Pharmaceutical Society and the Commonwealth of Pharmacists Association. A family man, Andre enjoys spending his time doing the things he loves, which includes cycling, reading, baking, listening to quiet music, or enjoying a good movie. Mr. Beauville has a strong passion for healthcare and for understanding the burden of disease in respect to chronic NCD's epidemiology. To this end, he has given several talks to include Breast Friends, the Antigua Barbuda Caribbean Association of Pharmacists, and the Medical Benefits. He has participated in many health-related initiatives over the years. Andre continues to relish in any opportunity he gets to speak on NCDs and other health issues. And I am sure that he's relishing the opportunity that he has this afternoon to talk to us on Cervical Awareness Month, general review. Without further ado, I introduce Mr. Andre Beauville.
Good afternoon, everyone. Happy New Year to you all. Okay, I'll just read from my slides. You'll hear me. It was the current head of the WHO, Tedros Ghebreyesus, that says that cervical cancer is highly preventable and treatable. And I was able to find in my research from an anonymous survivor who said, "Don't let fear keep you from going to the doctor." And so it brings us to the observance of Cervical Awareness Month and why we observe this month as Cervical Awareness Month. Just for general information, this month has its origin in the United States. And since it came into being, it's been adopted by, I guess, the UN World Health Assembly, and by and large throughout many countries around the world, most countries actually. And it's observed in January every year. The key is that its observance helps to signify the deadly impact of cervical cancer, and also inculcates measures to promote women's health generally. Again, the head of the WHO advocated that through cost-effective and evidence-based interventions, including HPV vaccination of girls, screening and treatment of cancer lesions, and improving access to diagnosis and treatment of invasive cancers, we can eliminate cervical cancer as a public health problem and, get rid of the disease. So the key objectives of observing Cervical Awareness Month are: one, to encourage women to be more attentive to their cervical health, and to create that area, that space where women, through advocacy and through various treatment regimes and accessing care or accessing health services are concerned, that they can detect any health issue at the earliest stage and as well seek the best available treatment, while at the same time seeking to raise awareness of cervical cancer and the HPV virus, or the human papilloma virus. And also, one of the key things in respect of the observance of Cervical Awareness Month is to create that awareness of the human papilloma virus vaccination. We say in these days, we say HPV vaccination. Just to give you a historical perspective of things, persons may want to know where did this whole issue of cervical cancer, cervical awareness month, understanding the HPV virus or human papilloma virus, understanding how to treat and manage cervical cancer or prevent cervical cancer from occurring in our populations. How did this all come about? The literature points us way back to 1886, where British physician Sir John Williams would have discovered cervical cancer, so to speak, even though I believe that the condition would have been around prior to his discovery. But I would say that he was the one that actually, wrote on the condition, the first instance. Then we had in 1943, Dr. George Papanicolaou, that's the Greek guy, and Herbert Trott. They presented a paper on the diagnosis of uterine cancer by the vaginal smear. And we all know the famous word pap smear. That's the Greek doctor, Dr. George Papanicolaou, who for whom that diagnostic technique, or after whom, sorry, the diagnostic technique is named. Notwithstanding, they're saying that in 1943, they put forward that paper. You could go as far back as 1941 when Dr. George and Herbert and others actually started work on identifying or trying to devise a technique to help diagnose cervical cancer. Then we come all the way down to 1976, where it was Dr. Harold Zurhusen who uncovered the HPV DNA in cervical cancer and genital warts. Even though at the time, when he made the hypothesis, many of his colleagues had doubts, but he nonetheless persevered and put forward his results. And so in the 70s and early 80s, persons started looking closely at the human papilloma viruses, a family of viruses. Then come 1990, where two Australian scientists developed the HPV vaccine. And thereafter, we have 2006, where the first vaccines were approved for use in Australia and the USA. And since then, 2007, we saw 80 countries approving the use of the HPV vaccines. And then come all the way down to 2019. By 2019, we had over 100 countries, and recent checks suggest that it's now 115 countries that have approved the use of the human papilloma virus vaccines in their populations. So things have come a long way and far away. And so we're here today observing the Cervical Cancer Awareness Month. Just some general statistics and facts. Cervical cancer is the 4th common cancer in women. For Antigua and Barbuda, I may want to term it the 3rd. We have ahead of cervical cancer, we have breast cancer and colorectal cancer. So it's sort of within the top 4, generally, in Antigua. In 2018, an estimated 570,000 women were diagnosed with cervical cancer worldwide. And Of that number, 311,000 died from the disease. In 2020, we had this number jumped to 604,000 diagnosed and just over 340,000 dying from the disease. Globally, the burden is greatest in low to middle income countries, and this has to do with access to public health services being limited and, of course, screening and treatment not being widely available. Fortunately, in Antigua, you know, based on our last ranking, we are not necessarily considered as a low income or middle income country. I think we are a little way above that. And as we can all attest, there's been great improvements in terms of access to care for women, whom, you know, and even later on, you'll see why we have greater access to care in terms of treatment for cervical cancer. So cervical cancer in the Americas or in Latin America and Caribbean is among the leading cause of death among women. In the Americas, it's estimated that over 35,000 women die each year from cervical cancer. And of that number, 80% live in Latin America and the Caribbean. So we can understand, you know, the burden is very great in our region. Deaths in 2030 are estimated to increase to over 51,000 persons. And they're saying that from projections, about 89% of those deaths would be in Latin America and the Caribbean. So within the next 8 years or less, projected deaths would be just over 51,000. So as a country, we have a lot to do to improve things. In respect of approaches to care, and I'm certain that Dr. Tulloch in her presentation would speak to these definitively, there's what we call effective primary care, in which the focus is really on human papillomavirus vaccination. Then there's a secondary care or secondary approach, in which there is attention to screening and screening for HPV cancer or precancerous lesions and treating those lesions. And evidence suggests that doing this will help to prevent most cervical cancer cases. Notwithstanding that, when should a person be diagnosed? And the fact that cervical cancer, based on the science, is one of the most successfully treatable forms of cancer. Once it's detected early and managed, then we expect, you know, healthy prognosis. Cancers diagnosed in late stages can also be controlled with appropriate treatment and palliative care. So we have come some ways from way back, I would say from the 70s right up. You know, things have improved within Antigua and Barbuda. Global approach to combating cervical cancer. The global approach, in May of 2018, the World Health Organization initiated a call to action for the elimination of cervical cancer. And by August 2020, the World Health Assembly adopted the global strategy for elimination of cervical cancer. And this global strategy has some key elements. 3 key elements are: 1, a vision of a world where cervical cancer is eliminated as a public health problem. And we can understand why now that we know the origin of the disease, or the medical people would say the pathogenesis. We understand the disease process, how it starts and what triggers it, and how it can be managed or treated. Then another key element or target, as they would say, is that there's the projection that they want to reduce what we call the incident rate of less than 4 cases per 100,000 women. So they're saying that within a population of 100,000 women, or for every 100,000 women, we want that for every year going forward, that we have a minimum of just 4 cases or less. And that's one of the targets or elements of the global strategy. And then another key element of the global strategy is that the implementation of what is called the 90-70-90 targets that must be met by the year 2030 for countries to be on the path toward cervical cancer elimination. And this is one way of measuring where countries are at by the time we will have gotten to 2030. And this simply means that we're looking to have at least 90% of girls fully vaccinated with HPV vaccine by age 15 years, 70% of women being screened with a high performance test by age 35 years of age, and again by age 45 years. And you'll understand why those landmarks, or those, not landmarks, those age boundaries. I think the general literature suggests that by age 45 anyway, you're exposed in some form or fashion to many of the HPV viruses. So vaccination at that age wouldn't really, through to 45, wouldn't really be of any benefit. In fact, I think the doctor might correct me. There might be, I think there's a cutoff in terms of vaccination. Some people go as far as through to age 27. And thereafter, the issue is screening and testing for HPV. Then, as part of the 90-70-90 target, there's the need for 90% of women identified with cervical cancer disease to receive treatment. And this is in respect of the 90 being, if they have precancerous lesions, they must receive treatment. And if they have some form of invasive type cancer, they must receive treatment. Notwithstanding all that, to accomplish strategy, every country must reach and maintain these 3 key targets within the lifetime of today's young generation. And this is very important if by the year 2030, that many of these targets are to be achieved, or these 3 targets or elements of the global strategy are to be achieved. One key thing I must state is that Antigua is part of the global strategy, having signed on to the global initiative. This brings us to the actions that are required in respect of understanding and managing and preventing or eliminating, HPV, not HPV alone, cervical cancer, And one primary prevention, this is where vaccination of adolescent girls is most effective, is touted as the most effective long-term intervention for reducing the risk of developing cervical cancer. And so that's one of the key things that countries are promoting. And not only for girls, but boys too. Focuses on boys because we know that HPV can cause other issues, young men. Then there's the secondary prevention, which is to reduce cervical cancer incidence and mortality by identifying and treating women with precancerous lesions. And of course, the tertiary prevention, where we look at suspected or confirmed cervical cancer cases, and we provide the necessary treatment, right? I must say that in our jurisdiction, there is treatment involves either surgery, radiotherapy, chemotherapy, and of course, palliative care. In respect of the local scene, as I said earlier, the country signed on to the global initiative in 2030. I know we have in place National Cervical Cancer Task Force that's very active. Children, girls, and young boys have access to HPV vaccines in Antigua. I know right across our public health system, there's the promotion of regular screening. And I dare say treatments are available. And I know for a fact that through the efforts of the Ministry of Health, we're working to reduce the stigma associated with cervical cancer. And of course, there's the various advocacy initiatives that are out there and groups that go about seeking to promote good cervical health. And with that, I just want to encourage women, girls, even the men, if they might be listening in, that we should all seek to fight cervical cancer and through our efforts provide hope to those affected. And we encourage our women, our girlfriends, our wives to go and get screening. And if we have young girls, 14 and under, we should seek to have them receive the HPV vaccine. All right. And with that, I'd just like to thank you very much for listening, for being good listeners. And thank you again. Good evening.
Wow, thank you so much, Mr. Bovell. A very, very interesting presentation, giving us all of the facts and taking us back through the history of cervical cancer. And like Mr. Bovell has said, do not let fear keep you from going to the doctor. And just in case you have, and don't let fear keep you from going to the doctor. And Mr. Bovell said, January is Cervical Awareness Month. And again, he did mention that it is the 4th most frequent cancer in women and the 2nd most common cause of cancer death in reproductive women globally. I mean, take a minute to think about that. A lot of females are signed in. And even if you aren't female and you're male, you do have female family members. You have a mom, a sister, a daughter, and it's something to really think about. But you are helping us to celebrate or to observe Cervical Health Awareness Month because you've already began by being a part of this online event. We're gathering facts about cervical cancer. And of course, I'm hoping that by the end of this, we will be scheduling our appointments for screening. Mr. Bovell referred to a world with no cervical cancer, or moving towards that because we're now developing a better understanding of the development of the disease and how to manage the disease. And we're hoping to, of course, reduce the incident rate to less than 4 cases per every 100,000 women. Think about our population, the population of Antigua. Can we get 4 cases for every 100,000 women? That would be excellent. So in addition to joining our podcast or our symposium and gathering facts, we also have to think about how we can, in our own ways, work towards reducing the incidence of cervical cancer. And to do this, we have Mrs. Gardner, Mrs. Susan Gardner. We may know her as the nutritionist who works with the clinics. And she's going to speak to us about foods that promote cervical health and minimize the risk of cervical cancer. Mrs. Suzanne Gloria Gardner is a Grenadian by birth, but a citizen of heaven by choice. And her mantra is, don't complain about the darkness, just light a candle. And if you've ever met Mrs. Gardner, you will understand that that is definitely her mantra, and it is something that she lives by. Mrs. Gardner holds a Bachelor of Science from the Northern Caribbean University, that's in Jamaica, and a Master's in Public Health Nutrition from the University of Technology, UTech, Jamaica. She's a certified master trainer in the chronic disease self-management from Stanford University and serves as a coordinator of this program here in Antigua and Barbuda. Mrs. Gardner works as a community nutrition officer in the northern area, covering the health centers at Clare Hall, Potters, Pickett's, Cedar Grove, Bishop Gates, and Barnes Hill. She enjoys her job and looks forward to opportunities like this to share her knowledge. So let's welcome Mrs. Suzanne Gardner, as she's going to share some information with us on what we can do or how we can eat to prevent cervical cancer. Mrs. Gardner.
Thank you, Mrs. Jenkins, and good afternoon to all. I need to start sharing my screen. Let me go. Let me get it into slideshow. Okay, just give me a section. Current screen. Okay, it's not allowing me to do that. Okay, good afternoon to all. As you know that food is an important part of our everyday life. We don't only eat food to live, but we eat food in a sense to help us with our care, especially with conditions that we have, that food will have an impact or influence on how much we can overcome that particular conditions. So I'm trying to get this into the slide. Okay, great. All right. All right, so we'll delve directly into our presentation, and as the topic says, cervical cancer and nutrition, diet and nutrition. Now, let us set the base. Cervical cancer is found in the cervix, which is the narrow or the lower part of the uterus, where it connects to the upper end of the vagina. So we know where it's located more or less. Now, the long-lasting infection with certain types of human papilloma virus, or what we normally would refer to as the HPV, is the main cause of cervical cancer. So yes, there are many other causes, but the main cause is the HPV infection. Now, as I started, I talked about food and the influence of food on our health conditions, or just to keep us healthy. Epidemiology studies suggest that dietary factors may influence risk for cervical cancer. So yes, diet plays a part. How does it work? Now, our diet helps our body to fight the HPV. It helps the HPV infection from transforming the cervical cells into cancerous lesions. Diet also, it helps with the preventative effects against the gynecologic cancer. And how it works, it seems to be having this antioxidant, anti-mutagenic, and the anti-inflammatory effects. So with our foods, whenever we have those types of food, whether it's high antioxidant food or anti-mutagenic foods or anti-inflammatory foods, we can see some form of benefits contributing to the management or the lowering of our cancer. Now, we are told that the benefit of the diet may be attributed to the suppressive action of certain micronutrients. So those nutrients, as I said before, have that suppressive action on the HPV infection. All right, so that's what is happening. We eat certain foods, and the nutrients of that food, whether they are classified as antioxidant or inflammatory, that they contribute to that lowering of the infection. So let's start with the flavonoids. Now, the antioxidant vitamins can act as efficient scavengers of the free radicals and antioxidants to prevent free radical damage to the DNA. We know the DNA is what we are made up of, and that basically the free radicals attack our DNA and can eventually lead to cancer. Now, what they are saying, these flavonoids actually works as broom sweepers, scavengers, getting rid of those free radicals. So we see the importance of having a diet rich in flavonoids. Now, flavonoids are believed to provide that protection against these cancerous cells. All right. Now there are some foods that are high in flavonoids, and some of them are apples, asparagus, black beans, broccoli, the Brussels sprouts, cabbage. I mean, I said cabbage, I'm not talking about that white cabbage. I'm talking about that either the purple cabbage or the dark green leafy cabbage. Cranberries, the garlic, the lettuce, lima beans, onions, garlics, berries, and spinach. So those are some examples. This list is not exhausted, but those are some examples of our foods that are high in flavonoids. Our second food group of nutrients we'll be looking at is the folate. Now, folate, its interactions appear to exist between the folate status and HPV, and that can influence our cervix cancer risk. So it lower our risk of getting cancer, the cervical cancer. Some studies have shown that women with high plasma folate concentration were at a significantly less likely to be diagnosed with cervical cancer, and especially when these women also have vitamin B12 levels that were now normal. Foods that are rich in folate include avocados, chickpeas, lentils, orange juice, romaine lettuce, and strawberries. Our next group is the carotenoids. Now, carotenoids might elicit protective effects through their antioxidant capacity. Again, because remember what I said earlier on, that those antioxidants, they help to get rid of those free radicals. So having a rich source of carotenoids in our body helps with that process. Now, these valuable sources of vitamin A are found in most fruits, vegetables, and beans, and particularly in orange foods such as carrots, sweet potatoes, pumpkin, and butternut squash. So again, the three main groups of those nutrients are what we call the antioxidants from flavonoids, the folate, and the last group, carotenoids. Now, these groups will help actually in having us have healthier cells that can help to prevent cancer. But we do have persons who are already affected with the cancer, and they are having some challenges. So how do we go about helping our family members, our friends, our colleagues? Now, we want to avoid foods such as foods that are high in saturated fats. foods that are high, not only high in carbohydrates, but specifically simple carbohydrates. And we also want to limit the animal protein. Alcohol is also shown to have put women at a higher risk for cervical cancer. So yes, we do want to reduce our intake of alcohol. Now, there are some challenges that those persons who are affected with cervical cancer might be experiencing. And they may be experiencing those challenges, nutritional challenges, just because of the cancer itself. So they may be having experiencing diarrhea, they might become constipated, they might be experiencing vomiting or nausea. Okay, so whatever the condition that is caused by the cancer itself, there are ways that they can find help. Okay, so those symptoms can be treated. You just have to talk to your healthcare provider, your nutritionist, your dietitian, and work out a plan that is most feasible for what you're experiencing. Because if you're experiencing diarrhea, it will be different treatment. So if you're experiencing constipation, based on the treatment that you are receiving, it can affect your sense of smell. With the sense of smell affected, your taste for food will be limited, and that can directly impact how much you intake. And if you are not taking in enough or sufficient calories or nutrients, it lessens your opportunity to fight the condition. Okay, so yes, your treatment may have a direct impact on your sense of smell and taste and how much you eat. So that again is something that you will have to discuss and able to get the necessary assistance or help. Fatigue, based on your treatment, you become very tired. And if you're very tired, you don't really have that energy to prepare meals or to even eat. And that again can impact how much you actually consume and may hinder the amount of nutrients your body needs to fight. Pain. You have your cancer patients, and the pain alone can prevent you from eating and eating properly, which again will impact your nutrients intake. So what we encourage you to do is to eat your best to feel your best. In other words, try and ensure that you have adequate energy foods. You want to eat intentional. You want to, it's not only when you feel like eating that you eat, but you tell yourself, okay, it's like my medication. I have to eat. I have to consume something. And when you're doing that, try to eat your best. Your best may not be having 3 square meals per day. It may be having 4, 5, 6, 7 small meals throughout the day. It may mean that you have to eat foods that are not, let's say, it's not the best quality, but that's that you can consume at this point. For example, making a smoothie may not be, or smoothie or juicing may not be the best for the time, but because that's what you can tolerate at that moment, go for it. Okay, eat as much as you can at any particular time throughout the day. You want to ensure you have adequate protein. Now, protein is important for the healing and repair of our damaged tissues. And again, we know the cancer is eating out at our tissues, our cells, and hence we have to have that amount of protein that will help our bodies to repair and to be in a state of wellness that will help to fight that cancer. Increase the next point, increase your fluids. In other words, especially if you are experiencing vomiting or diarrhea, you want to ensure that you are well hydrated. Find your fluids from different sources. It doesn't have to be only water. Well, yes, water is good, but if you are trying to build that level of energy and calories, you need your fruit juices, you need other nutritious fluids that will help to build your level of fluids. All right? In summary, I want to encourage you to reduce cervical cancer risk by practicing the long-term consumption of flavonoids, antioxidants, such as the vitamin A and D and E, your carotenoids, and folates. Those foods that I would have mentioned before, eat foods that grow around you, like the spinach, the sweet potatoes, and let me say the sweet potatoes, whether the yellow sweet potatoes or the orange sweet potatoes, the carrots, the butternut, pumpkin, those foods that are very accessible to us. We want to ensure that we consume those. Remember, long-term consumption of large amounts of high-risk foods, like the saturated fats and sugars and so forth, we need to avoid them to lower the risk of the gynecology cancer. In summary, no single food can provide all the nutrients you need, okay, for your situation. So there is not one magic food, okay? So we encourage you to use a variety of foods as much as you can tolerate. Ensure foods are safe. Remember, your condition is very unstable in the sense. So ensure that your food preparation is safe and the quality of food you are getting, they are safe for consumption. Now, I'm encouraging you to experience with spices and seasonings to see what are appealing to you at that stage, because of your sense of taste and sense of smell will be limited. So you want to use some spices and seasonings that will help to boost your appetite. Look for the best foods to help you fight your uphill battle. I'm encouraging you to take care and be safe throughout the season as you face your challenge with cancer. Thank you.
Thank you, Mrs. Gardner, for such a wonderful presentation. Now, I will take a moment to remind our participants that if you have any questions, you may type them in the chat so that we could read it out and have one of our panelists answer or respond to your question. Like Ms. Gardner said, we have to eat well, and maybe our well or my well may not be your well, but what is important, or the message that I can get from that, is that we make a conscious effort to choose the foods that are better for us, and to eat the frequencies that work or that suit our schedules. So we're going to work on decreasing these saturated fats and these simple carbohydrates and the alcohol. Definitely, I would have to work on that as well. I'm happy that Ms. Gardner mentioned the types of food that we were supposed to eat. And so far, you've already been celebrating or observing Cervical Health Awareness Month by joining our symposium. and you're collecting facts. And while we're waiting on you to make that screening appointment, let's revamp that grocery list. And let's make sure that we have our flavonoids and our folates and our carotenoids. And what I loved about it, a lot of the items that Ms. Gardner called out are things that we can grow in our own yards, like pumpkin and carrots and lettuce. I mean, she did talk about strawberries, but the way the pocket's set up, maybe. If you can do it, then you do it. But if not, we always have our butternut squash and our dark green leafy vegetables and things that are available to us. So let's not make an excuse that everything is expensive and that the groceries are expensive. I mean, I know that they are, but we can start digging up our backyard and move aside the hibiscus so that we can plant a pumpkin plant or some green peas or some lettuce. Another thing Ms. Gardner mentioned was the symptoms. And I don't know about you, but some of these symptoms sounded like COVID. Affect your sense of smell, affect your sense of taste, nausea, vomiting. So let's be conscious. I mean, if we do get those screenings, then we can definitely know what direction we're going into, whether we're going the COVID way or the cervical cancer way. And really and truly, we don't want any of them. So the best thing is for us to find out as early as possible. So before we move on to our next presenter, I'd like to take a minute to address one or two questions from our panelists. And I see the first question: what are the current research updates on a HPV FDA approved test for men? Okay, all right, so we've taken the unanimous decision to move on to Dr. Tulloch for now, so it will give us an opportunity to identify the questions, because the questions seem to be coming faster than I can handle them. So continue to put your questions in the chat. If you can send your question directly to the host or panelist, it may make it a little bit simpler or easier to identify your question so that we can address it, so that it doesn't get lost in the number of messages that are going forward. So Ryan and Lacey, if you can please put your questions directly to the host and panelists so that we may be able to address it without it getting lost in the conversation. And I like to go back to what Mr. Bovell said, do not be afraid to go to the doctor. And in case you are afraid to go to the doctor, this evening we are bringing the doctor to you. Our next presenter is Dr. Cherie Tulloch. She's a graduate of the University of West Indies, Mona, Jamaica, where she completed her medical training, including her postgraduate training in obstetrics and gynecology. She has been a doctor for more than 10 years and is currently a consultant in the Department of Obstetrics and Gynecology at the Celeste Bird Medical Center and Mansour Medical. She also serves as the chair of the Cervical Cancer Task Force in the Ministry of Health in Antigua and Barbuda. Dr. Tulloch is a passionate about women's health. Her area of interest is in the prevention and management of gynecological cancers, such as cervical cancer, and she hopes to play a role in decreasing the burden of gynecological cancers on women in the Caribbean. So I'm going to invite Dr. Tulloch to join us. Remember, please, to post your questions, and we will address it as soon as Dr. Tulloch is finished with her presentation. Welcome, Dr. Tulloch.
Okay, I'm sorry. I was muted all this time. Okay, good night again, everyone, and thank you for having me join this discussion. I'm happy to be a part of the discussion and to be following Mr. Bovell, who's making my job a lot easier. He went through the historical aspect and they basically outlined everything for us. And Ms. Gardner has added an entirely new dimension to the prevention of cervical cancer through our choices in nutrition and our diets. So today, I'm going to be basically going over what cervical cancer is. How does cervical cancer happen? Why are we talking about this? How can we prevent it? If we end up being diagnosed with it, how do we treat it? And how is Antigua and Barbuda tackling this problem? And what can you do to be a part of the solution? So cervical cancer is cancer of the cervix. So the cervix is the lower part of the womb, what a lot of us know as the neck of the womb. And the cervix plays a lot of roles. The cervix stays closed so that we can carry our pregnancies to term. The cervix is also a protector of the inside or the interior of our womb, right? It prevents infections from gaining access to our womb and our fallopian tubes. So the cervical health is very important. And so I'm glad that that's the term I've been hearing tonight, cervical health. This is what the cervix looks like when we look at it from below. So when you come to our office and we use the speculum, this is what it looks like. And this is a normal cervix right here. And over here, you can see a cervix that's already been affected by cervical cancer. Now, what's important for us to know is that basically all our cases of cervical cancer are caused by the human papillomavirus, what we know as HPV. It causes more than 99%, which is virtually all our cases. Now, there are about 200 types of HPV. 14 of them are responsible for causing cervical cancer. But HPV on a whole is actually quite ubiquitous. It's everywhere. It's on surfaces. It's on our skin. And so while we will say that almost 80% of persons in their lifetime will be exposed to HPV at some point and get that infection, 75% of them will get that by 18 to 22 years of age. You don't have to have sex to be exposed to exposed to HPV and get HPV infection, right? And that's important because one of the common questions we get is that if you're not having sex, then do you need to do your pap smears? Does this apply to you? And the answer to that is absolutely yes. All right, so HPV can gain access through your skin, through your hands, and through other forms of non-penetrative sex or sexual activity. And HPV infection is as common as the cold. Now, HPV not only causes cancers, but it also causes warts. Okay, so this diagram here is just showing you warts on the hands, warts on the sole of the feet, on the fingers, genital warts, right? So warts occurring around on the penis, on the vulva. That's HPV, but it's not the HPV that causes cancer. And these do not go on to become cancerous, right? Actually, the HPV that causes this are HPV type 6 and 11, okay? And what I want you to take home most of all is that most people who have HPV infection actually have no symptoms. So a lot of us will have it and have no signs. But who do we really worry about? We worry about the ones that are going to go on to cause cancer. And like I said, there are about 14 types that have been identified as being as causing cancer. And cancer is a result of a persistent infection. So you get HPV infection with one of these 14 types and it's not cleared. It gets to stick around and that's how it causes cancer. And as we can see, even though we're speaking about cervical cancer tonight, HPV doesn't only cause cervical cancer. It's responsible for a majority of anal cancer, vaginal cancer, penile cancer, head and neck cancers, and vulvar cancers. And overall, it's responsible for about 5% of cancers in the world. Now, how does HPV do this? Well, the first thing is the virus gains access. It gains access to the cells of the cervix. It basically avoids detection by our immune systems. It sets up camp, right? Once it realizes it hasn't been detected, it finds a nice spot and it sets up its camp and it basically hacks into the cells system and holds up the cells and it integrates itself into the DNA of the cells. And basically it starts to form its own population of cells. And as it is with any cancer, cancer cells don't behave like normal cells. They don't serve a function and they just take over and they kill the normal cell population as it grows and it invades, right? It's like a bad movie. No, HPV doesn't happen over a short period of time. Most persons will actually get infection and clear it. 90% of persons actually who get HPV infection will clear it. During that time, however, over maybe the course of months, it can still cause changes in the cells. Those are usually mild changes. And this is when we start to talk about the precancerous stage, the stage before we start talking about cancer. And you may just have some mild abnormalities. And then we start to see level 1, level 2, and level 3 changes. Level 1 and level 2 changes usually happen over months, and persons can clear that. Persons can clear the HPV infection and reverse these changes, okay? So there's still a chance that even though we see some of these abnormalities, that your body may actually deal with it on its own before intervention. However, when we start getting to level 2, which we call CIN1 and CIN3 abnormalities, the likelihood of someone clearing it successfully on their own, that starts to decline. And certainly once you get to level 3 changes, or what we call CIN3, which are high grade changes, the risk of going on to have cancer of the cervix increases significantly. But the progression from infection to cancer happens over years. And we're not even talking about a short period of time, like 5 years. We're talking about 10 years, 20 years, 30 years for some persons. Now, there are certain aspects, individual aspects that can affect the time that it takes to progress along this line. And it's going to depend on certain things like when persons first became sexually active, the number of sexual partners, whether they're using condom, do you smoke, what, and we just spoke about healthy lifestyle, dietary choices, what kind of lifestyle we're leading that can either help our bodies do a better job of decreasing that risk, and what choices are we making that may put us at more risk, right? But we're all at risk, and that's important for us to understand. So actually, we see most of the HPV infection actually occurs before the age of 30. And then persons may clear it. But the persons that don't clear it, over time, and we see it in the 30s, 40s, and 50s, those are the persons that we tend to see with the precancerous changes that are higher level, like 2 or 3, or who come with cancer. And this is what you see. So you go from having a normal looking cervix to a cervix that's starting to show these changes, until we reach a point where we don't need a pap smear to tell us something is wrong with the cervix, right? We do pap smears on persons who we can't detect the abnormality with our eye for. Now, this looks like a complicated slide, but I don't want you to be taken aback by it. I have this slide here simply to demonstrate something. So here we see level 2 and level 3, and then we're talking about cancer. This is level 1 and less, anything below level 2. And all these different colors show is just a different type of HPV that's causing this abnormality. So we see that in mild changes, we see basically of the 14 types, we see them all represented here. Yes, this blue box here, which represents HPV 16, is still predominating. And then we move on to level 2 abnormalities, and we see this blue box get even bigger. This is HPV 16 causing a majority of our cases of precancerous level 2 changes. And then you see right here, this is HPV 18. And then we go on to level 3 precancerous changes. And again, HPV 16 is taking the cake along with HPV 18 here. And then when we get to cancer, we still see HPV 16 and 18 causing about 70% of our cancer cases. And that's important when we start to talk about vaccination. Now, cervical cancer, as Mr. Bovell said, is the 4th most common cancer worldwide affecting women. And in 2020, more than 500,000 women were diagnosed with cervical cancer, and more than 250,000 women died from the disease. And this graph is just showing us that when it comes to cervical cancer and you compare the more developed countries to less developed countries, unfortunately, countries like us in Antigua and Barbuda, within the Caribbean, Latin America, Africa, we're the ones that are responsible for 90% of the cases and 90% of the deaths. And here we're just seeing the same thing, cervical cancer being the fourth leading cause of death in women worldwide. Same thing here. This is just showing us the incidence, that is the number of new cases that we're seeing every year. And we see that in the darkest blue is where we're seeing the highest numbers of cervical cancer cases, and it's all below the equator. It's happening in Africa, Latin America, and the Caribbean are responsible for about 1/5 of the cases. And then you have here India and so on. And when we start looking at deaths, it's the same thing. Most of the deaths are occurring in countries like ours. Now, in Antigua and Barbuda, cancer is a problem. Cancer is responsible for about 1/4 of the deaths from non-communicable diseases. And when we talk about a population where 50% of the population are women, and almost 50% of households are led by women, this is important. This is extremely important. And here we're just comparing now the incidents in Antigua and Barbuda. We're looking back. And as far back as 1984 to 1989, and persisting right to 2005 when we have our last statistics published by Dr. Simon et al., you see that cervical cancer was the second most common cancer affecting women that was being diagnosed in women. It's second only to breast cancer. And here, same thing. So when we look at the number of cases per 100,000 women being diagnosed per year, the world average is 13. And for the Caribbean, it's still 13. But when you look at the statistics that were represented for Antigua and Barbuda for the 2001 to 2005 period, you would see that Antigua and Barbuda ranks amongst one of the highest incidence rates in our region. And that's something that we need to change. For the same period of time, for 2001 and 2005, when you look at the cancers that was taking the lives of our women, cervical cancer, which is the only cancer in this group that's actually preventable, is the third leading cause of death in our women for this period of time. And when you move a little bit further and say, okay, let's see how we're doing more recently, between 2014 and 2018, cervical cancer is still the third leading cause of death in our women in our nation, and the top 5 overall, even if you look at both sexes. What is even more concerning is the age distribution, right? And here we see for the precancerous disease, and this is actually expected, most of our precancerous disease is occurring in our younger population, our 20s and the 30s. And as women get older, the ladies who go on to develop cervical cancer tend to be in the older age group. But this is traditionally what we see. When we look at the statistics coming out of the oncology department for the Sir Leicester Bird Medical Center between 2016 and 2020, cervical cancer, and this is for the gynecological cancers, and these are the cancers that gynecologists see. Cervical cancer is the most common cancer that is presenting to the oncology department for gynecological cancers. And this is the only cancer that we can prevent, so this should not be. When we look at our statistics in terms of the number of cases that the oncology department is seeing per year, What is concerning is that between 2019 and 2020, we have a doubling of our cases. And while we didn't see that trend continue into 2021, we are unsure if that may be a result of women not presenting because of COVID and because COVID did affect the health seeking behavior of everyone for the last 2 years. But definitely for last year, these women who may not have presented, we may unfortunately start seeing them presenting this year. And unfortunately, those who didn't present last year but should have will be at a later stage when they present this year. This is a slide that concerns me the most. It's the age distribution of the women that are being seen in oncology department with cervical cancer. If you looked at the slide I showed you before, most of the women were in the 50 to 60 age group. But now what we're beginning to see when we look at a longer period of time is that our younger women are being diagnosed with cervical cancer. So cervical cancer is no longer in the 5th decade of life or just the 4th decade of life, but we're starting to see cases in persons in their 30s, right? And persons below the age of 50 are almost equally representing as much as those over 50 in terms of the number of cases that we're seeing. What is also very discouraging or sad is that most of our women are not presenting early enough to be treated with simpler treatment options like maybe just surgery. And I say simply loosely. But the reality is that once a lady is presenting in either a late stage 1 or beyond, we have bypassed the opportunity for surgery to be the cure or to provide us with the cure. And we're looking for chemotherapy and radiation to help us achieve that cure. And our ability to achieve that cure decreases as the stage of presentation actually increases. So we need to change this. So quite apart from decreasing the number of women who go on to develop cervical cancer, we need the women who do to present earlier in the disease process. What is good about Antigua and Barbuda is that most of the women are getting treatment. 70% receive treatment. Unfortunately, we still lost 33% of women during this time. Now, the question everybody asks is, who is at risk? Am I at risk? The truth is, every woman is at risk. As long as you're a woman, you're above the age of 21, you've never had a hysterectomy, that means you still have a uterus, your cervix is there, you are at risk for developing cervical cancer, irrespective of the type of sexual behavior, choice, or orientation. It does not matter. We are all at risk. Now, there are certain things that can either further increase that risk or decrease that risk. One of the things that can increase the risk of going on to develop cervical cancer is the coitarchy or starting to have sex before the age of 18. Now, we see actually about 10% of our deliveries at the hospital are teenage deliveries. So what that tells us is that there's a fair percentage of our population of children or teenagers who are engaging in sexual activity early. That is a reality. That is a reality. So this is something that requires us to address it. We have to start educating our children. We have to start protecting them and teaching them to have a healthier approach to sexual behavior. Bear in mind, regardless of age or number of partners, we're still all at risk. Co-infection with other sexually transmitted infections, including herpes infection, which is actually more common than persons recognize, because not everybody who has it will actually have signs, which is the same thing with HPV. But the presence of these also increase the risk of going on to develop cervical cancer. Having multiple partners, either at once or over a period of time, or having a partner who has multiple partners also increases your risk of being exposed to the high-risk HPV types and therefore going on to develop cervical cancer. Not using a condom also increases your risk. So a condom doesn't eliminate your exposure to HPV, but it can decrease that exposure. Prolonged exposure to OCPs for some persons, so this is not to now discourage persons from using their contraceptives, but there are some persons who the progesterone in the OCPs may actually play a role in increasing that risk. If you smoke, smoking has been linked to an increased risk for not just cervical cancer, but so many cancers. Smoking is just never a good idea. If you have signs of HPV, so any other type, so the chances are that if you have genital warts, if you've been exposed to HPV 6 or 11, then of course you have to assume that there is the risk that you have been exposed to the high risk types. Or if someone has, if you've ever had a pap smear that showed that you had high risk HPV, then of course there's an increased risk of going on to develop cervical cancer if other measures are not being taken. If you've had an abnormal pap smear in the past, that also increases the risk of going on to have cervical cancer. If you've had any other cancer in the genital tract, then that also increases your risk, right? And if your immune system is affected, therefore, if you have HIV or if you're on immunosuppressive medications, or persons who have autoimmune diseases, persons who have had organ transplants, therefore, those persons would also be at risk for an increased risk of not clearing HPV infection and therefore going on to develop cervical cancer. So how can we prevent it? Now, the WHO has outlined everything that we need to basically eliminate cervical cancer from our shores. Now, as I said earlier, most of the HPV infection is happening before the age of 30. So the first step is vaccination. Vaccination before our children are actually exposed to HPV, right? And remember, at some point our children are going to grow up, they're going to start their families, and so eventually everybody is going to be exposed to HPV. But the key is to vaccinate them before they get exposed, when the vaccines have their greatest efficacy. Even though they're getting vaccinated, they still have to do their screening. And we actually also encourage women over the age of 30 to do HPV testing, which is available in addition to, as part of their screening for cervical cancer. Beyond this, we also encourage women to present early in the disease process and also avail themselves to all the treatment modalities. So it's high quality treatment means that we're more likely to be able to achieve that cure. Now, the cornerstones of elimination is going to be prevention is vaccination and screening. And when we talk about vaccination, we're talking about Gardasil and Gardasil 9, which are available here in Antigua and Barbuda. And screening, we're talking about the pap smears, which most of us are familiar with, and HPV testing. Now, there are actually 3 vaccines available. Gardasil, Cervarix, which most of us would not be familiar with, which covers HPV 16 and 18. All of them cover 16 and 18, but Cervarix only covers 16 and 18. But the one that is available to us here in Antigua and Barbuda through our clinics is Gardasil, which covers the 4 types. It covers the 2 that causes warts, and it causes the 2 that are responsible for cancer. And if you start the vaccination before the age of 15, our children only have to get 2 doses, but anyone over the age of 15 would have to get the 3-dose schedule, right? Most of the side effects are just discomfort at the site. Fainting can occur for some, but we haven't had any reported serious events for us here in Antigua and Barbuda since our HPV vaccination program was introduced in 2018. And I want us to just realize that HPV vaccines have been introduced since 2006. And so there is a tremendous amount of safety data. More than 270 million doses have been given, and it has been shown to be a safe vaccine. This graph over here, I just put it here to show you that even though we will be exposed to HPV, we will mount our own immune response, the vaccine gives us the best benefit in terms of a sustained immune response going forward that will protect us. Okay. All right, so what are the benefits of vaccination? Well, first of all, it prevents about 90% of HPV-related cancers. It reduces the number of precancerous lesions that we have to treat, and it also reduces the presence of genital warts. Pap smears, that's our next step in prevention. Should be done, started at the age of 21. You can stop at age 65 if your last couple of three pap smears were negative. And it should be done with HPV testing, ideally in women over the age of 30. Now, women are always very apprehensive of doing their pap smears, but I want to encourage persons to go where they're comfortable and make sure you get it done. Don't let somebody else or anything else be the reason you don't do something that may save your life, right? Pap smears don't hurt, but cervical cancer does. I promise you that because we've seen it. And remember that pap smears are not done to detect cancer. Pap smears are done to prevent cancer. So people are afraid to go because they're afraid of what it's going to say, but pap smears are not done to detect cancer. We're doing it to prevent it. So what if the pap smear is abnormal? Just relax. Yes, it's unnerving, it's uncomfortable, but most times the pap smears are only mildly abnormal, right? And even when we go on to do further testing, it's usually mild abnormalities. And again, this is usually in the precancerous stage, okay? So most people just have mild abnormalities that will clear on their own or require very little intervention. For those who have an abnormal pap smear, we usually go on for some of them, we will go on to do what we call colposcopy, where we take a closer look at the cervix with a microscope. We apply certain solutions so that we can see the areas that are abnormal. And depending on what we see, we take a biopsy, we send it to the pathology lab for them to tell us, is there any abnormality there? If there's an abnormality, is it level 1? Is it level 2? Is it level 3? And depending on what it comes back showing, there are lots of things that we can do to remove the area of abnormal cells and prevent it from going on to become cancer. So we can freeze the area of abnormal cells, or we can basically cauterize it. That's using like burn it. We can, well, laser is not something that's available here, but it's something that is available in some countries. And sometimes we do what we call a loop, where we basically just scoop out that area that's abnormal and remove it altogether. But what if it's cancer? It's okay. First thing is pay attention to your bodies. What are the signs that you should look out for? And I'm going to go through them. You're going to recognize that it may sound like something you have experienced at some point, either because of fibroids, endometriosis. There's a tremendous amount of overlap between the symptoms of cervical cancer and some of these other things. But one of the things I want to say, first of all, is that in the very early stages, especially either in the precancerous and the very early stages of cervical cancer, there are no symptoms. There are no symptoms at all. And that's why it's so important that you see your doctors regularly and that you're doing your pap smears and that you get your vaccination. But as it starts to progress, what you may notice is an unusual discharge. You may have bleeding either in between your periods or after sex. The periods may get heavier and longer. You may start to have discomfort in the area, either when you're passing a urine or when you're having intercourse. You may just, as it gets worse, as the disease progresses, you may feel tired all the time. You'll have pain in the pelvis, pain going down the legs, and weight loss. Now, please remember that even though I've mentioned these signs, cervical cancer is not the only thing that causes these, and I do not want anyone not to go to their doctor because they're afraid that the doctor is going to tell them they have cancer. It may not be cancer. And if you're doing your pap smears, then that's not going to be the first thing on our list. Now, as cervical cancer progresses, where we talk about stages, and most of us will be familiar with that, and that just speaks to the extent of the disease. How far has it gone? How far has it spread? Now, stage 0 means that it's still there in the cervix. It hasn't started to even invade. But when you get to stage 1, it's still in the cervix, and it's fairly easy to treat. We can do cone, we can do, where we just remove, and you'll see pictures of this later on, or we can do a hysterectomy, depending on the situation. And persons in these stages do very well with treatment. 5 years later after diagnosis, they're still around. Most of them are still around. When you get to stage 2, again, there's more disease, it's starting to spread, either into nearby tissues, or further down in the vagina. And as you can see here in the images, as you go to stage 3 and stage 4, just like cancer does, cancer likes to take over, right? It likes to spread, it likes to take over. And that's what we're seeing here. And the ability for us to achieve the cure goes down significantly, especially when you start talking about stage 3 and stage 4 disease. Now, worldwide, most women would actually present, or I should say in developed countries, most women actually present in stage 1. But in the developing countries, and as you saw in the slide earlier, only 13% of our women are presenting in stage 1. Now, how can we treat it? Like I said, we can do a cone biopsy, where we actually remove a large area of the cervix. We remove the area that has the cancer, and we create a margin of normal tissue that way we know we've gotten everything out. And that's for very early stage disease. Surgery beyond that is what we call a radical hysterectomy. It's not a typical hysterectomy. It's not just going in and taking out the uterus. No, we're going to have to take, more tissue, right? More surrounding tissue, to make sure that we've cleared everything. And so that's something that is still available, but we're still talking about fairly early stage disease. Once the tumor gets, or the cancer gets beyond a certain size, surgery comes off the table. And we start talking about radiation and chemotherapy to achieve our cure. Okay, that's how we're going to achieve it. And radiation is not just radiation from the outside, but you also have to get radiation from the inside as well, which we call brachytherapy. So cervical cancer can be treated, and we're still aim for a cure, right? So all these women here are survivors, and all of them are living, having been treated for cervical cancer. Now, question we sometimes get, how does this affect fertility, especially when we start talking about women being diagnosed in their 30s and approaching 40? How does it affect pregnancy? How does it affect fertility? Well, the good news is that cervical cancer being diagnosed in pregnancy is actually very rare. When it does happen, it's a very complicated situation, which I won't go into. But luckily, that's not something we have to deal with too often. What's important to note is that treatment for cervical cancer, however, does affect fertility moving forward and the ability to get pregnant. If someone presents early in the disease process, there are certain surgical techniques that can be done that may still allow someone to still have their uterus and go on to have their child. However, there are certain things that will have to be done because the risk of delivering early in a subsequent pregnancy will go up. So we do things like put a stitch in the cervix, or depending on the surgery, we put a stitch in the lower part of the uterus that is left behind. For women that have to go on to get radiation and chemotherapy, Unfortunately, that does affect the womb, it does affect the ovaries, and it does prevent women from being able to go on and carry a pregnancy after that. However, available in certain countries, not necessarily here in Antigua, but you can actually have your eggs frozen before starting treatment, so that you have the option of maybe a surrogate. That means somebody else carrying the pregnancy for you with IVF treatment. Ovaries can also be moved away from the area of radiation to decrease the risk of them being injured during treatment. Now, I spoke about surgery that can be done for persons with early stage disease. One of these is called trachelectomy, just basically removing the entire cervix. So you're removing the entire lower part of the uterus, and you put a stitch in so that women can still go on to have their children. So this is done in someone who has a desire to go on to have children, but has been diagnosed with cervical cancer. So how is Antigua and Barbuda doing in all of this? Well, actually, I have to say, I think, we're quite fortunate. Antigua and Barbuda, unlike many islands, has almost a full armamentarium available for not only the prevention and elimination, but also for treatment. We have 26 clinics where you can get your vaccination, where women can get screened. For women who have abnormal pap smears, they can come up to the hospital. We have a colposcopy clinic. You have the oncology clinic, and then you have the cancer center and also for those who end up having cancer, you start your chemotherapy here, and then you go across to the cancer center where you can get your radiation. And in private physicians' offices, women also are able to access HPV testing. So Antigua is actually doing pretty well in terms of providing the necessary services. Now, what we're not doing a very good job at is managing our costs, the cost of cervical cancer or cervical disease. Now, these are very crude estimates, but what I've outlined here is the estimated cost of preventing cervical cancer in one person versus the cost of treating someone who presents with cervical cancer. So if we're preventing, the lifetime crude estimate, of course, this can go up, it can be higher, but it will just be nowhere near here. We could be talking about less than 2,000 EC dollars. Whereas once we start to talk about treatment, and this is treatment, most of this is actually paid by Antigua and Barbuda. Healthcare is never free. Even though patients themselves don't have to bear the burden of this cost, somebody has to pay it. And we're talking about a minimum and therefore upwards of 70,000 EC per patient that has to be treated beyond the surgery, right? Requiring chemotherapy and radiation. And this is significant. And so we need to shift the balance and save our costs, be better stewards of our resources, and focus on vaccination and prevention. So the Cervical Cancer Task Force was formed in 2018, headed by Dr. Joyce and Walter Thomas, and they got us started, right? They refocused us and said we need to get vaccination on board, and so they oversaw the implementation of HPV vaccination, Gardasil, in 2018. It's now part of the vaccination program. It's community-based, primarily targeting children between the ages of 9 and 13. We know because this is when the vaccine is most effective, but it can still be given up to the age of 26, right? It's free of cost and it's optional, right? And even though it's optional, they educated and engaged the public to get persons to avail themselves to it. Now, in the primary target group, which is the ages 9 to 13, those are the kids that we want to get the vaccines to. In our first year of the program, didn't do too badly in terms of getting persons started. 1,000 persons, 15% of the group got their first dose, but only 2.9% of the group went on to complete the vaccination series. And so if we continue on this trend, there's no way that we're going to cover this number of children in the 4 or 5 year period. Okay, so this is something that we need to improve on as parents. We need to educate ourselves about HPV vaccination. As I said, it's been around a long time. It's been shown to be safe. And this is how we're going to give our children a cervical-free future. Oh, I also want to just point out what was encouraging here is that 54% of the doses were given to girls, which means that boys were well represented in the vaccination cohort. And it was very good to see parents doing that. We talk about cervical screening. We have about 25,000 women who require screening, who are in the age group for screening every 3 years. But here in Antigua, we do about 4,500 pap smears or cervical specimens every year. But this is not 4,500 women. The number of women covered by this is actually less. But if this is what we're doing every year, we are covering less than half of the women who need it every 3 years, right? So this is something that we have to improve on in terms of the number of women availing themselves to screening. Antigua has both the conventional PAPs, which is on the slide, as well as liquid-based cytology available. Most times the liquid-based cytology, which is the one that goes into the container with the fluid, is usually in the private physicians, but it is available. Only 10% of these samples are being done in the public system. And that's something that also needs to change. It means persons are not availing themselves to their screening. So where we know we have launched the vaccination, screening is widely available, including HPV testing, and we have almost the entire armamentarium needed for treatment of cervical cancer. The only thing missing is brachytherapy, which persons have to travel overseas for. And the WHO, recognizing this global problem, this preventable cancer that's taking the lives of our women every year, basically charged us with developing or implementing these strategies so that we can eliminate cervical cancer as a public health problem by 2030. So if we can vaccinate 90% of our girls before the age of 15, if we can make sure 70% of women are screened by age 35 and again by 45, and if we make sure that 90% of the women who have precancerous disease get treatment and 90% of persons who are diagnosed with cancer get treated, then we are well on our way to saving the lives of 5 million women by 2050. That's where we need to get. How are we going to do this, Antigua and Barbuda? We have to continue to collaborate. And that's what we're doing. So the ministry is collaborating with PAHO, with the WHO, with Basic Health International. We're working with interest groups so that we can continue to develop our infrastructure and basically offer a high level, a high quality system of screening to the population. Public education. So we need more opportunities like this where we can speak and where we can engage and we get to hear what your concerns are, what's stopping persons from going on to get screening, what's stopping them from getting their children vaccinated. We also continue to do training so that we can learn how to approach this better. And we continue to invest in infrastructure by basically trying to access high quality testing and screening for the population of Antigua and Barbuda. I want to commend the oncology department at the Sir Lester Bird Medical Center, who within themselves have been doing quite a bit of training. They're now headed by head of department, Dr. Yazigi, but here you have Dr. Shambag, who was with us and who was also a part of a lot of these efforts. And they have certified themselves and their staff in immunotherapy, in palliation, in having a comprehensive approach to cervical cancer. And so I really want to commend them because anybody who has been diagnosed with cervical cancer, they end up in the care of these lovely people. We spoke about engaging and public education, where we had our first cervical cancer symposium here in Antigua and Barbuda last year, and it was regionally attended. We had presenters from as far as Zambia, and we got to share our experiences, we got to share our knowledge, and a lot of our physicians and our healthcare members walked away a lot more confident in being able to educate persons about cervical cancer and also managing it in their own settings. Where we are now is that we are continuing to engage our interest groups, our PAHO, as we said, and our cancer center, our local universities, working with our the ministry, working with the Sir Lester Bird Medical Center, and we're continuing to engage persons so that we can move towards elimination, so we can invest in elimination. And where we are right now is that we're trying to get HPV testing widely available to persons in Antigua and Barbuda, because right now, to be able to get HPV testing is quite expensive. We're talking about 350 EC for HPV testing, so it's cost prohibitive. And we want to change that so that more women can have a high quality screening modality available to them. And so Antigua and Barbuda is taking the steps. We're getting there. So the cancer center opened in 2015. So women now have access to radiation. We have the formation of the Cervical Cancer Task Force in 2018 and the starting of the HPV vaccination in our vaccination program. And we had our conference last year. And now we're training to hopefully implement HPV testing as part of our national screening program. And so now what can you do? Well, the first thing is we need to start the conversation. We need to start the conversation, not just with ourselves, but also with the women in our lives, the women who we love, the women who are in charge of our households, 50% of the households in Antigua and Barbuda. We need to start engaging them. We need to start making women comfortable, not to have these conversations, not just about going to get their pap smears, but also about some of the symptoms they may be experiencing that may mean they need to see their doctor. And women should not feel ashamed either of being diagnosed with it or having to deal with, if diagnosed with it, having to do treatment. It can affect anybody. And this is what we need to prevent. We need to vaccinate. We need to vaccinate our children so that their future, in their future, they will not have to deal with the anxiety, or they will have to deal with less of the anxiety of an abnormal pap smear, and they will not have to deal at all with cervical cancer. Women and men, I'm encouraging you to speak to the women you love in your lives and encourage them to see their doctors every year. Every woman is supposed to have their well woman visit once a year. Your pap smears, we don't do pap smears every year. Pap smears are done every 3 years. And so we encourage women to make sure they're doing their pap smears. For women over the age of 30, we're encouraging you to do your HPV testing. And if you're starting to have any symptoms, listen to your bodies and see your doctors so that we can tell you, this is, hey, it's not something that you need to worry about, as in that it's not cancer, or, to determine what's causing it so that we can help you find a solution. Other things you can do is get involved. So this is Cervical Cancer Awareness Month. We're encouraging everybody to go and have their pap smears. We're encouraging persons to get their children vaccinated and put on teal. Put on teal, like me, for the rest of the month. Right now, the Cervical Cancer Task Force is also having a t-shirt design competition where We're engaging the children so that they can design the Cervical Cancer Awareness Month t-shirts for next year. So these are some of the things we can do to raise awareness and get people speaking about cervical health. And so the journey of 1,000 miles begin with one step, and Antigua and Barbuda is getting there, and we intend to leave no woman behind. And so I want to thank all these persons for helping me be able to present this information to you today. And thank you everybody for your attention.
Wow, Dr. Tulloch, you have blown us away with your presentation. And I am speaking for myself, and I am sure that I am speaking for the majority of the persons or the participants on this call today. I can see lots of questions. I can feel the excitement in the chat. I'd like to give you a few minutes because I've sent some of the questions directly to your message inbox. And so if you can just take a look at them and we can tackle them as you see fit. So we want to thank Dr. Tulloch for this presentation. And some of the things that Dr. Tulloch said, I for one did not know them. And I'm sure we are all learning lots of new information today as it relates to cervical cancer. Persons with HPV have no symptoms. So people are walking around with HPV asymptomatic, and we don't know, and we're interacting. And it is scary, but it's not as scary now because you're more aware, and that Dr. Tulloch has made has made us aware of all of the opportunities that are available to us. I mean, imagine cervical cancer is preventable, and yet still it is one of the leading causes of death of cancer deaths in our environment. And we really need to work towards that. Like she says, the journey of 1,000 miles begins with one step. So let us start our steps. And don't think that you will be left out or that you do not qualify, because as she had pointed out in her presentation, the age distribution is changing. And so we're seeing younger persons showing precancerous activity or showing cervical cancer. But she gave us lots of hope because she said, the earlier you diagnose it, the better your chances are, right? Early screening gives you a lot of more treatment options than if you were to be diagnosed at the late stage. We thank Dr. Tulloch for also highlighting all of these services that are available to us in Antigua and Barbuda. I mean, are we lucky? We are so lucky. We have clinics. We have clinics who are willing to administer free vaccines. And one of the things that a lot of people said with COVID, why are we making vaccines for COVID? Why don't we try to treat cancer? But we do have vaccines aimed at targeting cancer, and we're not taking advantage of that. So we really need to think about that. It's there for us to use. It's available free. If it is that we're not having enough education, let's educate ourselves and make use of what is available to us. We have our cancer center. We have the Sylvester Bird Memorial Center Oncology Department, and they are working really, really hard to deal with the cases, to provide treatment, to provide management of care. And we really want to, let's take advantage of the skills that they're putting forward to us. We also have MBS, who provides medication, who provides support. So let us count our blessings. Let's count what it is that's available to us, and let's take that step to that journey, and let's work towards fighting cervical cancer. Dr. Tulloch, I invite you to respond to any of the questions that are the numerous questions that are in your inbox at the moment.
Okay, thank you so much. Let's see. All right, so let's start with, if you get the Gardasil 9 vaccine, can you still get cancer of the cervix?
Excuse me, Dr. Tulloch, I'm sorry. Can you start over because you were a little bit muted?
I was?
Am
I clear now? Okay. All right, so okay, so the first question I see is, if you get the Gardasil 9 vaccine, can you still get the cancer of the cervix? No, it is very unlikely that you will. If you get the vaccine and you're doing your screening, please remember that if you get the vaccine, you still have to do your screening. Between those two, it would be it would be very unlikely for you to go on to develop cancer of the cervix, because the vaccine helps to helps your body clear the infection more effectively. And even if one of the viral types were to get past that first step, screening would help us pick up the changes long before. Remember that when it takes like 10 years, 20 years, sometimes 30 for you to go from infection to cancer, right? It can be shorter than that in some persons, but generally you're talking about around 8 to 10 years. So there's a tremendous amount of time to pick up changes and treat them and prevent cancer. So no, it's very, 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 very unlikely for you to go on to develop cancer. Second question, okay, I think that's the same thing. Okay, is it unlikely for someone to develop cervical cancer after 65 years? That depends on what you were doing before 65. Were you doing your pap smears before? So if you were not doing your pap smears before and there is a precancerous change that is there that is not detected, that is not treated, then it's possible that you can still go on to develop cervical cancer after the age of 65. So remember, the caveat to stopping screening is that your last 3 screens have to have been normal, and you could not have had high risk HPV in any of them. All right, so that's where that it depends. All right, what does HPV testing entail? So basically, HPV testing it's not an extra step. It's just whether it's requested on the sample. So remember I said there are 2 types of screening. You have your conventional PAPs. You may be familiar with the slides where we basically use a brush on the cervix and we put it on a slide. And then some persons will be familiar with we're doing the brush of the cervix, but we put it in a container with some liquid. And so for those that we do that on, we can actually request that they test HPV on those very same samples. So it's not an extra step. It's just basically your ability to do it depends on which one of the screens that you're testing that you're doing. In your opinion, the stress and cortisol impact? Well, stress and cortisol levels generally affect your immune system. And that doesn't just have to do with cervical cancer. That goes for any cancer and basically any disease process. So an overall healthy approach to life, which includes decreasing your stress levels, having foods that improve your immune system, getting adequate sleep, taking away the toxic habits, so like smoking, all those things can decrease your risk of overall of developing cancer in general, cervical cancer being no exception. All right, so what is the current research update? So in terms of HPV testing for men, currently, as far as I know, there is none. Unfortunately, so men end up being more like carriers of HPV. Penile cancer is not very common. Even though most of it is caused by HPV, it's not very common. And most times men carry HPV, but they're not affected by it, right? And so testing in men is not very useful. Actually, we cannot treat HPV infection. And that's an important thing for people to know. We can't treat infection because if we did, then we would just treat it and not have to do the pap smears to look for the abnormalities it can cause. There's no treatment for HPV infection. So if there's no treatment and there's no precancerous stage to pick up for men, then there's no point in testing them. Testing is important for HPV testing is important for women because of our cervical cancer, and because we can actually treat a precancerous, we can treat in the precancerous stage to prevent cancer. So it's useful in that context. Outside of that, it's not useful for men. And I suspect that's why there is no approved test as well. That's part of the reason. If you are high risk, meaning that you tick several of the boxes on the slide and you're over 35, how often should you have your pap smear done? Well, once you're ticking a few of those boxes and you're over the age of 35, you should be doing your pap smear with HPV testing. That's the ideal recommendation. you should have HPV testing as part of your assessment. Outside of that, if you're not able to access it because it is expensive, then you should be doing your pap smears at least every 3 years. At least every 3 years. And that goes for everybody. Oh, okay. So the cost of the HPV. So remember I said there's Gardasil and there's Gardasil 9. Gardasil is free. So if you are up to the age of 20, once you're under the age of 27, you are able to access Gardasil, which covers 4 types of HPV, 6 and 11 that causes the warts, and 16 and 18 that causes most of our cervical cancer. You are able to access that free of cost at the clinics. Over the age of 27 and above, up to the age of 45, the ideal vaccine is the Gardasil 9. If you're going to talk about getting any vaccine, that's a conversation you have to have with your doctors. Actually, even if you're younger than 27, if you're able to afford the Gardasil 9, that's a good one for you to get. It covers 9 types, so it covers some other high-risk types that Gardasil doesn't cover. That one is 500, a little over 500 EC per dose. So if you are below the age of 15 and getting Gardasil 9, which some parents do give their children, right? Then it's 2 doses. 15 and above, it's 3 doses that you're going to end up having to get. And so the overall cost will be about 1,500, more than 15, a little over 1,500 EC in total, right? So just want to make the other point, Gardasil versus Gardasil 9, people ask, so doc, which one should I get? Gardasil 9 covers more types, so if you can afford that, then get it. But both vaccines are very good at decreasing your risk of cervical cancer. They both have high efficacy for decreasing the risk of cervical cancer. Remember, that's what we're trying to prevent, right? So either one, but if you can get Gardasil 9, if you can afford it, you can get that one. Also clarify, does pap smear include HPV testing? No. So HPV testing is simply testing for the presence of HPV. Is the virus there or not? If the virus is there, which one is there? Do you have the high risk type, meaning the ones that can, if it sticks around, can lead to changes in the cells that can become cancerous? Or do you have the low risk types, which we know are not going to cause cancer? So that's HPV testing. The pap smear looks at changes in the cells. So if the HPV infection is there, it starts to cause changes in the cells of the cervix. And so the pap smear itself looks for changes in those cells, right? So it's 2 different aspects that we're looking at in screening rather, okay? I hope that was clear. Did I answer all the questions? I don't see any more.
There are 2 more questions.
Sure.
Ooh, I just lost it. Let me get back to that. One participant has asked whether cervical cancer is a family trait, because she's saying her sister had it, her aunt and grandmother and cousin have all died from it. And so she would like to know if it is something that is hereditary. And the second and final question says, at the age of 43, without a uterus, is there still a risk of getting cervical cancer?
Okay. All right. So the first question is, cervical cancer it's not one of those cancers that run in families. However, the question is...
Sorry, Dr. Tulloch, you're muted. Can you start over, please? Sorry about that.
No,
yeah, I think you muted me. Can you hear me now? Okay, all right. So the first question was, does cervical cancer run in families? No, it does not. It does not run in families. It is primarily caused, it is completely basically caused by the human papillomavirus. However, the question you have to ask, are the persons who are affected by cervical cancer in your family, did they do their pap smears, right? Because that may just be it. It is not impossible, however, to have certain underlying genetic predispositions to not being able to clear the infection, right? So there might be something that is unique. It's difficult for anyone to determine that definitively for you, whether there's something that may be in the family that makes you more at risk, right? But cervical cancer, that's not something that is generally passed on like that, right? It requires the presence of HPV infection to actually develop. The second question, Mrs. Charles Jenkins, could you repeat it for me, please?
Okay, the second question was that the person had mentioned that they're 43 and they do not have a uterus. At age 43, let me read exactly what it said, without a uterus, is there still a risk of getting cervical cancer?
So, excellent question. No, there is, you don't have a cervix, well, I'm assuming, all right, so you don't have a uterus. There are different types of hysterectomy. You can take out the womb but leave the lower part, that's the cervix. So that's important for you to know. Was the cervix taken out? Most times we don't leave it back. We take it out as well. So if the cervix is no longer there, then you can't get cancer of the cervix. However, remember, HPV doesn't only cause cervical cancer. And so the question that is important, or the bit of information that's important for you to know is, was there any precancerous disease in the cervix that was taken out? If there was, then you should still be doing smears. It's not called it's not like, it's slightly different because we're not doing it on the cervix anymore, but you're doing it inside the vault. And that should still be done, because the same virus that causes cervical cancer, if it was doing that, if it was causing changes in the cervix, it also increases the risk of having cancer of the vagina or the vulva. So it's still important for you to do your smear. So I suggest you have a conversation with your doctor, your gynecologist, and find out if that's something you need to do. But definitely you can't get cervical cancer if the cervix is not there.
Wow, Dr. Tulloch, it's almost like they don't want you to leave.
Have more questions?
I can understand why, because I am blown away. Definitely. Wonderful presentation.
Thank you.
Let me take a minute. Someone has asked if we intend on sharing this information. Yes, this information will be available on the MBS YouTube and channel and Facebook page. That information will be circulated later, maybe not this evening, but from later this week, by tomorrow. I guarantee you that it will be available to you. All right. So at this point, I'd like to say, what can I say but thanks? Let me first start by saying thank you to the Medical Benefits Scheme. We're using their facilities currently, and it's just one more step that they've taken in their action to fight against cervical cancer, to fight against cancer, to promote wellness, and to promote good health. I want to thank our prevention department. I'd like to thank Ms. France and her team. They've put in quite a bit of work to get this symposium going, to invite our participants. And I just want to say thank you for facilitating this very, very important discussion. For the last few sessions, we've left our IT team for last, so I don't want to forget them. And so at this point, I say thank you to our IT department, especially Mr. Alden Grant, who has been kind enough to stay with us and run up and down in between the computers to assist us with our technical difficulties and help push this program forward. I'd like to say thank you, thank you to our panelists. I mean, without you, who would be sharing this information and helping us leave with a lot more wealth of knowledge, a bigger, wider wealth of knowledge than we came in with. I want to say thank you to Mr. Boville, who took us through the historical aspects of cervical cancer and the development of the pap smear, which is really, really a fundamental screening tool in the early detection of cervical cancer. We want to say thank you to Ms. Gardner, who has brought it to our attention that you don't have to win the lotto to eat healthy. And so if you can't get the strawberries and the blueberries, we can get the pumpkin and we can get the carrots and the squash, and we can steal some spinach off our neighbor's fence, but don't tell them that I said to do that. All right. I encourage you as much as possible to visit our community nutritionist. We have a number of nutritionists at the local clinics who have a wealth of knowledge and who are excellently equipped to take you through your journey of wellness. And of course, I want to say thank you to Dr. Tulloch, who has provided what I think is a wonderfully broken down presentation. It took us, it didn't, normally sometimes we have presenters who speak above our heads and we're still a little lost. We smile, yes, but we're lost. And I want to say thank you, because I am guaranteeing you that nobody's lost today. A lot of persons have learned a lot of valuable information. You've given us a lot of hope that of the importance of the screening process, and that we should not be afraid to get screened, because there are options for us. Cervical cancer is preventable. And if we are able to detect it early, there are a number of options that Dr. Tulloch has brought to our attention that could be very valuable in the management and the treatment of this disease condition. So what do we remember from you, Dr. Tulloch? Who is at risk? Remember, everybody with a uterus is at risk, okay? You are at risk, I am at risk, and if you're male, the females in your family and in your immediate surroundings, in your workplace, all of these persons are at risk, right? So let us take steps to decrease this risk. Start the conversation. Education. Education is important. Let us educate ourselves. Let us educate our households. There are more than 50 participants on this call, and I'm sure if each one of you were to take the information that you've learned, not to one person, but to your household, to your workplace, that information will spread like wildfire. And there will be a lot more persons. You may be surprised that you will reach someone who probably was too shy to access that information through the mainstream wing. Let's work on our diet. Let's put those flavonoids and those carotenoids and those everything else is into our diet except the saturated fats. And let's work on that. Let's schedule regular checkups. Remember, vaccination is important. Let's not fight the vaccine. It has been proven to work. It's around, it is available, it is free. What else do we want? Let's schedule those checkups. Let's do the screening. Let's speak to our children, educate our children about the use of the vaccines, about HPV, about practicing safe sex. It's something that we don't want to talk about, but it is something that will happen. It's going to be, it may not happen today, it may not happen tomorrow. And you want to have some control over what's going on and providing the necessary education to your child or to the children in your family. Let us understand that as long as you have a cervix, you are at risk. And finally, I want to say thank you to our participants. More than 50 persons logged on, wonderful, wonderful participants who have asked questions, who have shown that they have been paying attention and they have been learning, and who have taken the time out to be here with us this afternoon, this evening. And we want to say thank you so much to our participants, because without you, who would we talk to? So let's start that conversation. Prevention through vaccination, screening. Let's explore treatment processes, regular and timely checkups, and let's save the lives of the women in our societies, in our households, in our communities. Once again, I want to say thank you and good night, and thank you so much for joining us. Have a good evening, everyone.
Have a good evening. Thank you.
Thank you. Thank you.
Let me invite Mr. Boville to give a word of thanks before we leave.
Okay, good night again. And let me just say a quick thank you to all of the attendees. Thank you to our presenters, Ms. Susan Gardner, Dr. Tulloch, thank you very much. And thanks to Mrs. Evel Charles Jenkins for so ably hosting today's session. Thank you, thank you, thank you. God bless you. Do have a safe evening, safe weekend. Stay safe. Protect yourself and family from the scourge that's out there currently, COVID. And more importantly, have your family, women in your family, go get checked, screened for cervical cancer. Thank you.